These are my thoughts in this time of COVID-19. If the revolution will not be televised, then what we see on the TV is not the revolution. If the revolution will not be televised, then what we see on the TV will always not yet be the revolution, not yet the total destruction of this world for another, not yet the crumbling to ash of the totality of anti-Blackness for something else. The revolution will not be televised because it is always too early or too late, uncapturable by the camera's aperture, like Fred Hampton and the Black Jacobins. Too early and too late, untimely in this world's time, its timing and rhythm. The revolution will be out of this time, out of time, against the rhythm of this world. It will be in the break of and the breaking of its beat. And so, it will not be televised.
I live between Southeastern Europe and California, and I'm speaking today as displaced subject stuck somewhere in Southeastern Europe. I'm in Macedonia at the moment. It's a former Yugoslav republic. I'm around 20 minutes from the Greek border now.
I'm speaking from this absolutely idyllic setting. It's the first time I've been out of my apartment in 4 months and out of New York City. So we got away this week upstate and have been getting a respite from what has been a difficult 4 months in New York with the sirens and the deaths all around us and the morgues in the street and the stress of knowing that one can get it at any point.
I find it hard to trust or share out loud my perspective on these times because I feel my perspective is such a privileged one in so many ways. I live in a U.S. state that implemented lockdowns early and in a county that has never had a significant number of cases. My small family and I live in a relatively big house with a playset in the backyard in a neighborhood where one can easily go for walks while maintaining significant social distance. I have a job as a professor that I did not lose and which does not require me to put myself in harm's way. I only had to teach a small graduate seminar during our university's first hastily prepared remote term. I had even just put together my tenure file, so I didn't have to decide whether to extend my tenure clock or worry about whether, even with an extension, my research productivity would be high enough to keep up with the quarantine output of men and faculty members without young children. Still, I have a 4.5-year-old and 2 dogs and a wife, and we were all spent 2.5 months together in our home, and it was so exhausting, and patience was so hard to come by, and I could barely fulfill the bare minimum of my professional responsibilities, and I couldn't even hear myself think.
I sheltered in place in Bogota, Colombia through the month of June, and I'm currently in Cabo Rojo, Puerto Rico. Both places are navigating surges due to opening the economy before having experienced an initial peak and flattened curve in COVID cases. Puerto Rico recently rolled back the current reopening phase, the most significant feature of which was opening the international tourist economy on July 15th. Indignation about U.S. tourists who have refused to wear masks in this U.S. unincorporated territory, that is to say in this U.S. colony, even before the reopening, follows on the heels of government corruption and inefficiency, a lack of testing, contact tracing, and access to information, the rise in domestic violence and femicide in the context of the quarantine, unattended unemployment claims, and denied nutritional assistance requests.
So I'm here in this country where an aspirational fascist sits in the White House. Nationally, this country is a mess. The government is unwilling, and in the case of those members of the government who are willing, or not unwilling, unable to put together any coherent response to the pandemic. As our government's mismanagement of this crisis is truly exceptional. We're living what is called U.S. exceptionalism in the flesh right now. The country that always postures as the biggest and the best and the most and number one in everything, now really maybe number one in creating a humanitarian disaster. The collapse of our medical system, the unmitigated, unapologetic slaughter of the old and the ill. So we're witnessing a spectacle of white masculinist nationalist politics on a tragic comic scale here in the United States.
During the first weeks of the quarantine, we had no idea of what would happen. We knew that there would be millions and millions of deaths. The virus was possibly everywhere. And we had moved in a flash from a bulldozer economic and financial system that never stops working and producing to almost no business at all. So we were going through strange times, as many of us have awkwardly phrased it in our emails.
So we experience this crisis as a crisis, essentially in a sense, because we are left to ourselves. And being left to ourselves is not a good way of being supported in one's humanness. It's essentially we're kind of living out the model of the liberal modern individual, and thus able to see its distortions. We are left to ourselves with our stuff, our own property. We are separate from the world and separate from other people. And it is essentially the cause of great suffering.
Well, we're living through an unprecedented moment, but not completely unpredicted given US politics over the last few decades. Certainly, the emergence of COVID-19 onto the global scene has alerted us to a state of unpreparedness that certain economists and historians have been decrying for years now. We're seeing a new normal where policies on masks have oscillated 180 degrees from not being effective to necessary for health and safety. And in turn, we're seeing a kind of stigmatizing and virtue signaling around wearing masks that in some ways is the stark opposite of supposedly Western enlightened disapproval pre-COVID toward Muslim women who wear the niqab. And now it turns out that they may have been among the safest folks on the planet all along in terms of hygiene outside of medical staff.
Mask wearing has become this absurdly politicized act. On the far right, where our government sits, to wear a mask has, for months, been seen as the equivalent of losing one's manhood.
We have witnessed contradictory declarations about masks, for instance. First, we have been told that they were absolutely useless, and a few weeks later, they became mandatory.
But I also worry about the way that many of us who lead comfortable lives settle into the smug moral disciplining of populations based on one-size-fits-all safety procedures. What does it mean to conform to mask-wearing policies or quarantining safety practices while ordering groceries or pizza or other goods from, in effect, neighbors who you don't know, who don't have the luxury of staying inside or don't have the necessary safety gear while they do their health careless, low-wage jobs? What does it mean to insist that everyone wear a mask when we understand that wearing bandanas or face covers for Black men get them shot, and wearing masks for Muslim women, before now anyway, got them ostracized and vilified? Do these about faces help us understand context better? Does it help us understand other perspectives? Does quarantining help us understand the loneliness that the elderly and disabled populations face? Does it help us consider how destructive solitary confinement on a much more amplified scale looks like? Obviously, these are not easily comparable, but I worry that our relative discomfort distracts us from the fact that COVID times for some populations, and for very different reasons, have been destructive or debilitating norms for many years before COVID.
Looking back on the months of lockdown, I'm struck by two sets of images from different parts of the world. The US media highlighted the tired, overwhelmed faces of hospital workers. They were sometimes in very makeshift PPE, even while citizens honked and cheered, hailing them as heroes on the front lines. The second set of images come from sources in India. When the lockdown was put in place, literally overnight, jobs for thousands of migrant workers in the cities dried up instantaneously. We saw hordes of migrant labor with no option but to walk back to their villages, sometimes hundreds of miles away. Many died of exhaustion, and many were beaten by the police for violating curfew. Now, I'm wondering at the different kinds of vulnerabilities and the different contradictions highlighted by these very different pictures and circumstances of our corona times. I wonder whether policies that allow for the unmattering of care workers and Black bodies in the US can be connected to structures that allowed migrant workers to be forgotten in the Indian cities during the pandemic.
For me, this moment in particular highlights the vulnerability of paid caregivers, the primarily Black and brown women who were employed as daycare workers, nursing home workers, domestic workers, and nannies. These are the workers who didn't have the luxury of sheltering in place. Yet this work is among the least valued, lowest paying work in the US. So aside from calling paid caregivers essential workers, paid givers certainly aren't paid as though they're essential. And as a consequence, paid caregivers are economically vulnerable because they're the ones who can least afford to miss work without devastating financial consequences. But they're also physically vulnerable to COVID, not just because they risk exposure by moving about to and from work, but also because the intimate nature of the work itself renders one vulnerable to COVID exposure. So remember that places like nursing homes have been COVID hotspots.
We're now being forced to see that the people in our society who actually do the most valuable work of all, the essential work of caring for others, are also disproportionately low paid as exploited workers and disproportionately oppressed as people of color. Since the crisis began, I've been involved in local worker organizing, tenant organizing, and coalition building. I've met so many people, nurses, hospital custodians, service industry and grocery store workers, tenant and mutual aid organizers, who are simultaneously on the front lines of battling COVID-19 and the front lines of anti-police brutality protests. That's because these struggles really are of a piece. The resources that should go towards care, to health, education, housing, and so on, have instead been diverted to massively expanded and militarized security and police forces whose basic function is and always has been to maintain profit by protecting the interests of the 1% against the rest of the 99%.
The Center for Disease Control in the United States records higher rates of hospitalization or death from COVID-19 within non-Hispanic Black, Hispanic, and Latinx, and Indigenous people than among non-Hispanic white people. Higher rates of underlying conditions, less access to quality health care, and disproportionate representation in essential frontline jobs impact Black and Latinx populations disproportionately. In New Mexico, for example, Indigenous communities have represented 60% of the cases, but they represent only 9% of the population. Rather than making live and letting die, the state's management of populations in the pandemic represents an extraction of value through death itself. In this context, we have seen remarkable protests, however. In the United States, approximately 26 million people have taken to the streets to protest anti-Black racism, police brutality, and the killing of Black men and women by the police. The Black Lives Matter protests are a weapon against the anti-Blackness at the root of modernity that manifests itself in the premature death of Black people, as Ferrer often reminds us, quoting Saidiya Hartman. To affirm Black Lives Matter in times of a pandemic that has disproportionately killed Black people is to capture life itself then, that is to say, to generate bonds by dismantling racism, the racial state, its modalities of violence, its productions of this world.
The uprising against systemic racism is met by this blatant, unapologetic, intensified race hatred on the part of the police, the white evangelical right, and with the further crystallization of white nationalist sensibilities in the portion of the white population that leaned that way anyway, now emboldened by a white nationalist president. So Oregon is my home state, and it's a poor state. 20% of Oregon's labor force filed for unemployment in the first 12 weeks of the crisis. A lot of Oregonians work in the service industry, which was hardest hit. And Oregon is historically a racist state, founded as a whites-only state, in fact, in law. So the triple crises faced by so many people in so many places, the pandemic, the uprising against systemic racism, and the total unraveling of the economy are all happening right here, right now. Just yesterday, a Black Lives Matter protester in my own town was intentionally run over in the street by a white driver.
If the revolution will not be televised, then what we see on the TV is not the revolution. We move in our lanes of us and them. So the them calls the us to say they are so sorry that we have to prepare our daughters and sons for gratuitous state violence. To say they are so sorry that we have to etch out lives in an unlivable anti-Blackness, as though what they have practiced all their lives, living in a defunct whiteness that is nothing if not anti-Black, can ever count as actual living. To ask, what can we do to help? As though the audacity of this question, its sadistic irony, doesn't occur to them.
On the 1st of June, we learned that President Trump retreated to his bunker in the midst of continuing demonstrations, demanding justice for George Floyd and an end to institutional racism. In London, England, where I live and work as a knowledge economy migrant, we were also in upheaval. Protests were being organized here too. And this, June the 1st, was also the date when our government decided to begin loosening the lockdown. Workers who had been furloughed or asked to work from home, obeying the hashtag directive Stay at Home Save Lives, were now asked to physically return to their workplaces if their employer asked them to, avoiding public transport where possible, because public transport was not and is still not deemed completely safe. The paradox was immediately spotted. Most workers rely on public transport, particularly but not only in London. Therefore, getting to work puts the worker at risk, even if one's place of work takes all the required precautions to minimize the chances of infection. Some of us, including myself, are still working from home and will do so for the rest of the year. The reversal of the stay-at-home directive for some workers amplified social inequalities to obscene levels, adding an necropolitical twist to a class system of remarkable resilience, a system that survives through constant mutation. COVID-19 and its mismanagement remind us that crisis is the rule rather than the exception in disaster capitalism. COVID-19 throws into relief inequalities so extreme that any return to normality becomes unthinkable, or in any case, politically and morally indefensible. Stay at home triggers a host of difficult questions. Is home safe? Do we all have one? Does yours have a bunker?
During a few weeks, a huge part of the population was reduced to inaction, cooped up at home, abandoned in a sheer anxiety and the fear of death, and we had not much more to do than to watch the news and to stare at social media. More specifically, we had ample time and the right acuteness of attention and the right vulnerability to witness many other people who had to face the pandemic without the protection and smooth conditions that we were lucky enough to enjoy. Hospital staff, obviously, but also supermarket workers, workers in meat plants. Many people were also cramped in small apartments, and for them, the interdiction to go out made life awfully difficult. In particular, in many suburbs where the quarantine has also provided the opportunity for more frequent and more violent police checks on non-white people. These inequalities are not new. They are not surprising per se, but the structure of the lockdown made their manifestation mind-blowing. A tenfold increased sensitivity arose. What occurred was simultaneously an absolute proximity and an absolute gap between, on the one hand, privileged people who turned into pure listening and watching beings and who experienced the risk of contamination as a close call, and on the other hand, people who were facing the pandemic and the same risk of contamination in the most violent way.
In Mexico, quarantine began only a few weeks after the enormous and unprecedented Women's March in Mexico City. Social distancing has raised many questions about political agendas. What could be done during the quarantine? How could feminist struggle and reflection continue from home? In Mexico, Quédate en casa
stay home has been the heart of the national social distancing campaign. However, there have also been two violent blind spots in this policy that have atrociously been assessed as collateral damage. I'm referring to domestic violence against women and to the lack of shelter for the population without a home or a safe home. These phenomena have increased dramatically during the quarantine. For instance, in the case of domestic violence, since the beginning of the quarantine, we have registered more than 200 feminicidios in Mexico, which represents an 8% increase in comparison with the first trimester of 2019. 911 calls from women seeking help have also shot up by 80%. There is practically no refuge, not for women and minors victimized by domestic violence, not for migrants, not for the homeless, not for those who cannot return home to their families because they have been rejected for their gender or sexual preference, etc. These social fine-tunings have been patches for a social debt to all the abject bodies of these homes, and these amendments are accomplices of the fiction of the family and the household as the normative horizon.
Question that just keeps circulating in my brain through all of this is just how should we live? Under that question, there are all these other questions that it carries with it, of course. How can we reconstruct our relationship to historical injustice so that we can take up our responsibility to mitigate those injustices? How can we guarantee that all basic needs are met so that when a shutdown happens, let's say in the next pandemic, those basic needs continue to be met whether the particular Congress in place at the time can agree on anything or not? And how should we reorganize our social networks, our economies, our essential institutions so that we can survive the next pandemic with a little more grace? I know they're huge questions, but those are the questions that in the era of COVID-19, we're really forced to ask.
The revolution will not be televised because the great break from all this, the fire next time, we can only pray, break and burn us all. Fred Moten says, what is supposed to be repaired is irreparable. It can't be repaired. The only thing we can do is tear this shit down completely and build something new. We're so not there yet. We still too dearly care for our targets.
The COVID crisis gives us an idea and a foretaste of what many people have immediately called the world after, a wholly alternative world. But it's just an inkling at that stage, certainly not a destiny. I don't think that the virus is the absolute other that can explode the matrix and force us to face an alleged reality. It does not force us to overcome capitalism. It does not force us to opt for degrowth or to acknowledge that we have messed with nature. So the idea of the world after is fragile, but it appeared in an ardent enough fashion to be treasured. It can operate in the incantatory and exhorting mode, but only in connection with actual engagement, without complacency, if we do not fetishize it, if we do not turn it into a token.
From feminist political economy point of view, pandemic opens sensitive questions about crisis of social reproduction. Economic crisis is actually political crisis. It's about distribution of capital. And from feminist political economy point of view, it's about focus on intersectional political economy and social care. So what is feminist here? It's about rising economic questions of redistribution in order to combat the hegemony of capitalism and to talk actually about common people and our lives in crisis while there is slow response of the society to the crisis. It's time when we need to lean to others, when we need solidarity as never before, because now we are all in a completely new, complex, political, rapidly spreading pandemic situation where questions on labor of care, invisible labor, essential workers, essential needs, women, love labor, and deep support have massive meaning to all of us to stay alive and to be human.
So, returning from this crisis, having learned something about ourselves, we might instead pursue the priority of not the protection of that modern liberal individual and her property, but to support that world without intimacy with which we suffer, support access to that world, support the enrichment of that world, the resources that that world provides, support the capacity to move around in that world, to be there, to be in it, and also to support the media of interaction with other people, the media that support our being with, and support those who care for that being with, who care for those people. Thus, we would return to the world supporting its resources and the opportunities it offers for communication, connection, company. Cultivating the world in its public spaces, the context in which we come together outside of ourselves in space, the context of care and development. And this, I believe, is a deeply feminist project. Cultivating the world in which we have our being and cultivating the relations and labor of care by which we cultivate our being with.
So, the life subject is the only one who can transform reality now. In Marxist feminist political economy understanding, we say that if the body is situation, as in times of pandemic now, then out of the logic of capital, we keep fighting, and we must keep fighting to stay human, because only human relations matter, and it's a really long fight against capitalism.
If the body is precisely the danger and the threat, says Ferrer Nunez, if it is going to become a weapon, then we're going to use the body precisely in confrontation to generate a social bond that allows not only to survive the pandemic, but also directly challenge power and with it trace other futures where solidarity is the compass of change. To protest in times of COVID turns being a weapon that undermines a social bond then into a weapon that attacks fear, isolation, repression, dispossession, and hunger.
So while the New York Times features wealthy, primarily white women who are discovering for the first time that it's impossible to balance work, family, and other responsibilities, it's important to acknowledge that this is simply the day-to-day reality for millions of women. And a truly feminist ethic must rectify this. In the Black feminist tradition, we've historically understood this. As the Combahee River Collective argued in a statement they released over 40 years ago, race, sex, and class are simultaneous factors in oppression. This moment of fracture on multiple fronts can be an opportunity for committed feminists to finally get it right.
The feminist movement should therefore think of itself as a broader struggle for equality and against violence. That the feminist struggle should follow an intersectional logic demands the recognition of an individualist and capitalist model that, on the one hand, denies that other forms of subjection and domination are as pernicious as machismo, and on the other hand, the recognition that if there are not dismantled, emancipation will be a mere fiction for the majority of women.
Sometimes I'm cynical about everything that's happening, and I don't think sympathetic white people are really going to back up their words with action. And I think when or if things go back to normal, white people will accept the smallest amount of reform and feel satisfied with how much better they are as people. But other times I see the New York Times bestseller list full of books on racism and being anti-racist, and I think maybe this really is the national reckoning we've been waiting for. And always, when I think about all the Black teenage girls who've organized protests, or the teenage K-pop fans who have mobilized to overload and shut down all kinds of white supremacy on social media, or about statues of Christopher Columbus being torn down by hand, I feel proud and hopeful.
On a note of cautious hope, I want to share some lines written by novelist and activist Arundhati Roy in the Financial Times on April 3rd, 2020. And this is what she says, I'm quoting. Historically, pandemics have forced humans to break with the past. and imagine their world anew. This one is no different. It is a portal, a gateway between one world and the next. We can choose to walk through it, dragging the carcasses of our prejudice and hatred, our avarice, our data banks and dead ideas, our dead rivers and smoky skies behind us. Or we can walk through lightly, with little luggage, ready to imagine another world and ready to fight for it.
So what I'm seeing as someone who theorizes social change is that the people are understanding their power. Things are happening now that I've never seen before and could barely have imagined just a few years ago. What the people are demanding is a society that cares, that puts people-making over profit-making, what feminists and socialists would call reproductive labor versus productive labor. So I think it's a truly exciting time to be an intersectional feminist philosopher.
What's also clear is that feminist solidarity is going to mean nothing if we don't really address class and race issues. Those in particular have come home, I think, very clearly in this pandemic in terms of who is most vulnerable, whose work the whole society relies on, which work really has the most social value, the most risk, the least wages, and sometimes no health care benefits or sick days. So feminist solidarity cannot be liberal. It cannot be conservative. It has to be radical, and it has to be anti-imperialist if it wants to mean anything at all for the majority of people's lives around the world.
We will not see the revolution on the TV because when it comes, we will be no longer. We ourselves will be revolutionized, undone and replaced by something unrecognizable, by something not yet seen, by eyes that know only the optics of anti-Blackness, by a camera's aperture that is too much of this world to ever be able to capture the revolution, the break into the next.